Hi everyone, I have Bob from Ontario, Canada here, and today I want to talk about failing implants. Failing implants, lots of doctors put implants, but they never say if they have a failure over an implant. It's always what I say, and lots of friends of mine, they say, if you don't have a failure, it's because you don't put implants. Remember that implants are external things that go inside your body. And if you have a failure on implants, there's two things to do. Just take it out, let that part of the body heal, and then you can reset an implant. And there's always a chance of having a rejection. Well, I have Bob here that had a rejection, and it's important. Yeah, I wanted to make a video about this because his story is very interesting. We placed the implants in 2011. Am I right?
Yes.
2011 we placed the implants, and they're working.
That was the first ones.
That was the first ones, and how they're doing?
Wonderful.
They're doing wonderful. That's important. And then he came again on 2014. So wow, we have 5 years, we have 4 years that we've met, and he's a great patient friend of mine also. And he came again to place 2 implants. This one's the lower ones, as you can see here. These lower ones, but this was done 1 year ago. And what happened? One of them, they were placed at the same moment with the same doctor, same drill, same everything. And what happened? One of them you started to feel it like loose. It just came out.
Yeah, it was getting sore, and it seemed like it was almost like abscessed.
Yeah.
And then eventually, after about a month or so, it just worked its way out.
Obviously, he got in contact with us and what should I do? What should I do? Don't worry, what we told him, it's a rejection from your body. So just take it out. The implant is here, by the way. Here's the implant, here's the implant. Why am I showing this? There's the implant, as you can see it there. Why am I showing this? Because it's important, because remember, what we're trying to do as doctors is the best that we can, and we place implants, and it's the same implant they use in Canada, the States, or in Africa. It's the same thing. It's a titanium cylinder that we place inside the body. Now, it's the body's turn to give the response. And that response, it can take starts from the first day, or it can start to give problems. You never know. Like, why do wrinkles, why do freckles, why do white hair comes out? We don't know. The same thing. Well, but this is a case of a failing implant. He has 4. We have more. 1, 2, 3, 4, 5, 6. One of them failed, and I want to show you what are we going to do. I told him, please just put it inside a box and don't worry, bring it back and I'll replace it for free, isn't it?
Yes.
And that's what we're going to do right now. But I want to show you how strong an implant can be. This one, the one that we have on the left, this one on the left, I want you to see how strong it is clinically, because it was done at the same time, at the same moment. We placed those 2 implants. Why does the body reject one of them? I don't know. It's something that if anyone can tell you, why are they rejected? We never know that, because it's more the body's way to react. So what we're going to do right now is this. Let me just show you. I'm going to put some light. Lay back a little bit, my friend. Let me just show you this. See, this is the implant that they were set here and here. See on this side how strong it is? I have the implant. This is the cover screw. But see how strong it is. I can move his head. We have a very strong implant, and this was a failure. But see how the gum is really nice. The gum, it's already healed. Just leave it a little time. The body is very intelligent machinery. So just let it heal. And what we're going to do is we're going to place another implant there, and problem solved. That's important just to understand, because sometimes it's like, oh, I have my failure on implants is around 2 to 3%, but if that's your case, well, don't worry, that's what can happen. It's like if you have a fixed tire, well, let's fix it up. No, that's the only thing. That's what I say. Obviously, it's not a comparison, but it's just to understand what can happen, because I have patients that they ask me, and if they fail, well, it's titanium grade 5, it's very compatible, it's an FDA-approved implant, but there's always a chance. And if this is the case, well, I really thank Bob for sharing, because it's important. Like, if you're watching this, like What if I have a failure on implants? Well, there's always a solution. It's important to get in contact with your doctor, to talk to your doctor. Obviously, doctors, I think there are great doctors all over the world, but depends on the doctor's point of view. Because if the doctor says, "Oh, it's not my problem, it's your fault," or whatever, there's no one's fault. It's both. We both share that responsibility, and we need to take care of it. And obviously, there's another needle, and we need to open, and we need to put the implant. Yeah, but I mean, it's health, and there's nothing like written in health. Everything needs to be done the best way that it can be, isn't it? So let's get started to work, and we'll see you later. Thank you.
Well, get into the website and see all the information that you need to send. That is technically is very simple, so we can give you an advice.